Hi guys, this is Dr. Denny Warren with Generations Health and Wellness Center, and I want to share some information with you about our ancestors and the health of our ancestors. One thing that we know when you study hunter-gatherer tribes all around the world, which as most of you know, that's what our expertise is in, they didn't have heart disease, they didn't have diabetes, they didn't have obesity, they didn't have autoimmune illnesses, they didn't have skin conditions, they didn't have cavities in their teeth, they didn't brush or floss their teeth, they didn't have a lot of the illnesses and diseases that we have today that are running rampant today. And it's all because they had a different lifestyle. And so one thing that I get asked a lot, because I'm a chiropractor, one thing I get asked a lot, well, did they need chiropractic? Well, there's two things that they did have. Here's one thing they did have. They had traumas, and less than 1% of the population had cancer. So if you think about a population that had to hunt down their food and gather their food all the time, there's a lot of opportunities and chances to have traumas for that. And many times it would have been beneficial for them if they ever had an open wound to actually have an antibiotic to help treat the infections because of that open wound. So antibiotics would have been very helpful. But another thing, when you study fossil records and you look at tribes all around the world, they did have traumas to their spine. So what that can lead to is traumas to their spine, traumas to their joints in different parts of their body that can lead to arthritis and lead to degeneration. Now, as a chiropractor, we work on helping to restore the health back in all the joints, especially around the spine, and to help stop the degeneration. So the type of work that we do in our office is called corrective care. Whereas if someone has, if their spine looking front to back is supposed to be straight up and down, but they've had some type of trauma where it knocked it out of alignment, by the way, that trauma could be just a habit of sitting with poor posture. Maybe you're getting your gangster lean on in the car. But those different habits can actually, over time, start to cause your spine to shift off out of alignment. So with corrective care, with the type of work that we do with scoliosis, we can actually help to bring that back more to midline, to improve that. Because if it stays like this and gravity compresses down on that, that's going to cause arthritis and degeneration in that joint because it changes the biomechanics of the joint. So we can help improve the biomechanics, improve the alignment, improve the structure and stability to help stop that degeneration. The same thing can be said for restoring the proper curves back into the spine. So did our ancestors need chiropractic? Yes, it would have been actually very helpful for them to have things like antibiotics, for them to have a surgeon, for them to have a chiropractor to help improve the health of their joints after any of those traumas that they had. So I hope this helps. Now, the one thing to think about for yourself, most of us have had traumas. Most of us had falls off a bike, sports injuries, sitting with poor posture in our desk throughout our childhood years, through our formative childhood years. We've had traumas like that our entire life. And either if you have pain or even if you don't have pain, it can cause arthritis and degeneration if you allow that to stay in your spine long term. So we can help prevent those problems. So if you have any questions about that, call our office. Let us know. We can do a full evaluation for you. But I hope that helps. Have a great day. We love you. We'll see you soon.